Hello, my name is Amber Richardson. I'm currently a student at William Patterson University in Advanced Health Assessment. Today I'm going to do my HEENT Cardiovascular and Respiratory Assessment. Do you give consent?
I do.
Okay, so initially I'm going to look at my overall general appearance of my patient. She presents in a good mood. She presents no signs of distress. I'm going to observe her head and scalp and hair. So no lesions are noted. Hair is evenly distributed. Do you know any pain or tenderness?
No.
Okay. I'm going to look at the overall shape and symmetry of her face. Her face is evenly distributed. Eyes and lips, nose all seem to be evenly proportioned and asymmetrical. Now I'm going to observe the eyes and I'm going to assess for central vision. So I'm going to use the Amsler grid to assess for your central vision. So with this Amsler grid, what you're going to do is focus on the dot
Okay.
and tell me if the lines appear blurry.
They do not.
Okay. Now any abnormalities for that would have been possibly myopia, which would be difficulty with seeing far distances. Now I'm going to have you read small print. This will be from a close distance.
Okay.
Any difficulty reading small print?
No.
Okay, which will be a normal finding as well. Now I'm going to check for the ocular eye movement. So I'm going to shine this light on your forehead. You're going to focus on the light. As I move in, the pupils constrict. As I move out, the pupils dilate. Okay, now we're going to do the cover and uncover test. No movement. No movement noted, which is a normal finding. Abnormal finding would be possibly strabismus. Now I'm going to check for the 6 cardinal fields. So I want you to follow my finger.
Okay.
So we're going to go up, down, left, right, up right, up left, down right. Very good, which will be a normal finding. Now I'm going to palpate the external eye structures above the eyebrows. Any pain or tenderness?
No.
Okay, I'm going to do underneath the eye. I'm going to observe the lacrimal ducts. I'm going to observe the sclera, which are white. I'm going to observe the pupils, which are normal for ethnicity. Okay. Now I'm going to observe the iris and then the lacrimal ducts, which were done as I stated. Okay. Now we're going to use the ophthalmoscope. I'm going to observe the retina and optic nerve. You're going to look here. No signs of hemorrhages. No signs of retinal degeneration. No discharge noted either. No lesions observed. Very good. Okay, now we are going to move on to hearing. Okay, so now I am going to use my ophthalmoscope. I'm going to look at the ear
Okay.
for any redness, drainage, or discharge. She's an adult, so we're going to move the ear up and back. Very good. Now we're going to observe the internal ear canal, which is free from any wax. The tympanic membrane appears gray and pearly. Okay. Now I'm going to do something called the whisper test. So you're going to cover one ear and you're going to repeat what I say.
Okay.
So you're going to cover this ear.
Okay. 99. 84.
Okay, very good. Now I'm going to have you cover this ear again.
35. 44.
Very good. Okay, now we are going to assess the nose. Now I'm going to look at the nose and assess for symmetry. The nose seems to be symmetrical. Very good. Okay. Now I'm going to inspect the internal nasal canal. Okay, so the nasal canal appears to be pink. No signs of occlusion. The septum appears to be midline. Very good, free from any occlusion. Okay, and the hairs appear to be evenly distributed. I'm gonna look at the bridge of the nose. Okay, very good. We note symmetry, which is a good thing. Now I'm gonna palpate the sinuses. We're gonna palpate the frontal. Any tenderness?
No.
And the maxillary. Any tenderness?
No.
Okay, very good. Now we're gonna move on to the mouth and the throat. So I'm gonna observe the lips and the buccal mucosa.
Okay.
Okay, so the lips appear pink and moist. I'm gonna have you open your mouth. I'm observing the hard and soft palate, which seem to be pink and intact. I'm gonna observe the gums, which seem to be pink and fit tightly around the teeth. I'm gonna observe the tonsils, which are pink, no signs of whiteness or white spots, which could be a sign of bacterial growth or candida growth, which would be like a fungal growth. Okay, now I'm gonna assess that the uvula is midline. As I stated, the tonsils are pink. Now I'm gonna assess cranial nerves 9, 10, and 12. So for 9, we're going to assess for taste. I'm gonna have you close your eyes.
Okay.
And just tell me what it tastes like.
Applesauce.
Okay, good. So that's intact. Now we're gonna assess cranial nerve 10. I'm gonna have you swallow. I'm gonna assess that, please. Okay, note to be a normal finding as well for swallowing. Now this is cranial nerve 12. I'm gonna have you stick out your tongue. Move it left, right, up, down. Okay, noted. Very good. I'm gonna have you open your mouth and swallow. Okay, good. The trachea and uvula seems to be in symmetry. Now I'm gonna assess the neck. Okay, range of motion. I'm just gonna have you roll your neck around. Turn left, turn right, down, up. Okay, very good as well. Okay, now I'm going to assess your lymph nodes. I'm going to assess the submandibular and then the occipital. Now, for lymph nodes on a non-sick normal patient, the lymph nodes are non-palpable and easy to move. No signs of tenderness, or they're not hard or fixed, which would be a sign of possible infection. Now I'm going to inspect the thyroid gland, which is here. Butterfly shape is noted. And this will be right above the trachea. Okay? Now moving along, we're going to do our respiratory assessment. So as of now, I'm going to look at the overall appearance of my patient's chest. No signs of distress noted. Respirations are easy and unlabored. Okay? So now what I'm going to do is I'm going to assess the shape of the thorax, which is oval shaped, symmetrical. As I stated, respirations are unlabored. Now I'm going to assess the tracheal position. The trachea is midline, which is a normal finding, so that's a good thing, which is a sign of healthy lung function. So now I'm going to assess for tactile fermentus. So I'm going to place my hands on your chest, and you're going to say 99.
99. 99. 99.
Okay, no tactile fermentus noted. I'm also going to palpate, and that's going to assess for any dullness. Okay, so resonance was noted, which is a normal finding. I'm going to auscultate the lung fields, and when I auscultate the lung fields, I'm going to start at the apex of the lungs. Okay, when I auscultate, I'm going to have you take deep breaths, okay?
Okay.
Take a deep breath in. 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 Now, it's also important when you're assessing for lungs, you're going to go in an S-shaped pattern, also go from left to right so that you can compare each lobe space. We're also going to assess the back now. Scoot up a little bit. Just scoot it. Oh, yeah, just like that. Again, I'm going to start at the apex of the lungs. Deep breath in. 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 Okay, again, I'm going to percuss the lungs again. Note for any dullness. So we also assess for the diaphragmatic excursion, and that would be where the tympanic sound heard would change from resonance to dullness, and that's basically measuring the chest expansion on inspiration and expiration. So it's about here. And a normal finding for diaphragmatic excursion would be 1 to 2.5 centimeters. Now we're going to move on to for one, I wanted to say when I auscultated, I was listening for intensity, quality, and the duration for any signs of respiratory compromise or any possible opacities or abnormalities of the lung. Now we're going to move on to the cardiovascular. So I'm going to assess the overall general appearance of my patient. I'm going to assess the lips for any signs of cyanosis. I'm going to assess the fingers, capillary refill is less than 3 seconds. Very good. I'm going to assess the extremities. No signs of edema noted. Very good. Okay, I'm going to assess the pericardium, which is right above the heart. No signs of hypertrophy noted as well. Okay, now I'm going to look at the point of maximal impulse, which is the 5th left intercostal space. No tenderness or abnormalities noted, as I stated before. Now I'm going to assess the carotid pulse one at a time. Heartbeat normal, no bounding noted, or weakness or threadiness noted. Okay, I'm going to assess the brachial pulses. The radial pulse. The ulnar pulse. The popliteal. The dorsalis pedis. And the posterior tibial. Okay. Now I'm going to assess again the lower extremities. I assess for edema. Now I'm going to auscultate the valves. I'm going to start with the aortic valve, and I'm going to use the bell of my stethoscope. The aortic is noted at the 2nd right intercostal space. S1, S2 lub-dub noted. Now we're going to move on to the pulmonic valve, which is the 2nd intercostal space. Now we're going to move on to earth point, which is the 3rd left intercostal space. The tricuspid valve, which is the 5th left intercostal space. And the mitral valve, which is the apex of the heart and the point of maximal impulse. S1, S2 lub-dub, no S3 noted. One thing I wanted to add is I'm going to observe the jugular vein. No distension noted. Distension of jugular vein could be a sign of heart failure. And that concludes my assessment. Thank you.